If you have knee pain after 65, what you eat every single day could be making it significantly worse. And I do not mean in a vague, general way. I mean specific foods. That research has directly linked to increased inflammation in the joints, increased cartilage breakdown, and more severe pain scores in seniors over 60. Most people focus on supplements and exercises, and those matter. But research from Cleveland Clinic and Mass General Brigham shows that certain foods directly trigger inflammatory responses in your joints every single day, 3 meals a day, 7 days a week. If those meals are working against your joints, no supplement is going to fully compensate. Today I want to walk you through 5 specific foods that research links to worse joint pain in seniors and what to eat instead. If you have been dealing with persistent knee pain and nothing seems to help, stay with me. This one might change how you think about your daily meals. The first food on this list surprises most people. Refined sugar. Not because sugar hurts your joints directly, but because of what it does to inflammation in your body. Here is the science behind it. When you consume refined sugar, your body produces advanced glycation end products. These are sometimes called AGEs. AGEs trigger an inflammatory response throughout the body, including inside your joint tissue. Over time, that repeated inflammatory response damages cartilage and makes existing joint pain significantly worse. A 2024 review published in the journal Nutrients found that diets high in added sugars significantly increase levels of inflammatory markers like C-reactive protein and interleukin 6, the same proteins that drive joint pain and swelling. The average American senior consumes over 17 teaspoons of added sugar per day. The recommended limit is 6 teaspoons for women and 9 for men. That is nearly 3 times the recommended amount, and the tricky part is that most of it is hidden. It is in your breakfast cereal, in your flavored yogurt, in your salad dressing, in your morning orange juice. You are not eating candy all day, but the sugar is still adding up. The fix is not about eliminating sweetness entirely. It is about swapping sources. Berries instead of candy, dark chocolate instead of cookies, fresh fruit instead of juice, and reading nutrition labels for added sugars specifically, not just total sugars. The second food is processed and red meat, hot dogs, bacon, sausage, and high-fat cuts of beef. These foods are high in saturated fats, which trigger the production of inflammatory cytokines in the body. Now, cytokines are signaling proteins. In normal amounts, they help coordinate your immune response. But when saturated fat intake is chronically high, cytokine production becomes excessive, and that excess inflammation settles into your joints. A study from Mass General Brigham found that people who regularly ate processed meats had significantly higher levels of joint inflammation compared to those who followed plant-forward diets. What makes this particularly important for seniors is that after 65, the body becomes less efficient at resolving inflammation on its own. Younger bodies can recover from a high-fat meal more easily. Older joints cannot, so the inflammatory burden accumulates faster. The swap here is simple. 2 to 3 servings of fatty fish per week, salmon, tuna, sardines, herring, provides omega-3 fatty acids that actively reduce joint inflammation rather than trigger it. If you do not like fish, a high-quality fish oil supplement providing 2,000 to 3,000 milligrams of EPA and DHA daily is a reasonable alternative. Talk to your doctor about what dose is right for you. The third food is white bread, white rice, and refined carbohydrates in general. These foods have a high glycemic index, meaning they rapidly spike blood sugar, and repeated blood sugar spikes trigger the same inflammatory cascade that directly worsens joint pain. Here is something that surprises most people. The connection between blood sugar and joint pain is not just indirect. High blood sugar directly damages collagen, the structural protein that makes up a significant portion of your joint cartilage. When blood sugar spikes repeatedly over months and years, the collagen in your cartilage becomes stiff and brittle. It loses its ability to absorb impact, and the joint pain that results is often mistaken for simply getting older, when it is actually being driven by diet. Research from the Arthritis Foundation confirms that a diet high in refined carbs accelerates cartilage breakdown in osteoarthritis patients over 60. The swap: whole grain bread, brown rice, oats, and sweet potatoes. These digest slowly, keep blood sugar stable, and contain fiber that actually lowers C-reactive protein, a key inflammation marker. The goal is not to eliminate carbohydrates, it is to choose carbohydrates that do not spike your blood sugar. The fourth one is alcohol, and this one is particularly relevant for seniors over 65. As we age, the liver becomes less efficient at processing alcohol. The enzymes responsible for breaking down alcohol slow down significantly after 60, so the same amount of alcohol that felt manageable at 45 has a stronger effect on your body at 65 or 70. Even moderate drinking, more than one drink per day, increases uric acid levels in the blood. Elevated uric acid is one of the primary drivers of gout, a form of arthritis that causes sudden, severe joint pain, most commonly in the knees and feet. Gout flare-ups can be debilitating. Some people describe the pain as feeling like their joint is on fire, and alcohol is one of the most consistent triggers. A 2023 study in the Journal of Rheumatology found that seniors who reduced alcohol consumption by even 30% saw measurable reductions in joint pain scores within 8 weeks, not eliminating alcohol entirely, just reducing by 30%. That is a meaningful result. The swap is not about total elimination, if that is not realistic for you. It is about replacing some of those evening drinks with anti-inflammatory alternatives. Tart cherry juice has been shown in multiple studies to reduce gout flare-ups and lower uric acid levels. Green tea provides joint protective polyphenols that have been shown to slow cartilage breakdown. The fifth food is fried foods, and anything containing trans fats. French fries, fried chicken, packaged snacks, and many commercial baked goods. Here is the mechanism. Your body needs a balance between omega-6 and omega-3 fatty acids to regulate inflammation properly. The ideal ratio is roughly 4:1. That is the ratio our bodies evolved to function with. Fried foods and trans fats flood your body with omega-6. In a typical Western diet, the ratio is closer to 20:1. That imbalance is one of the most consistent predictors of chronic joint inflammation in seniors. When omega-6 dominates, your body produces more pro-inflammatory compounds, and those compounds accumulate in the synovial fluid surrounding your joints, causing persistent swelling, stiffness, and pain. A Cleveland Clinic registered dietitian specifically named fried and ultra-processed foods as the top dietary drivers of joint pain. She sees in patients over 65, not just one of the factors, the top factor, the swap, extra virgin olive oil for cooking instead of vegetable oil or butter, air-fried alternatives instead of deep fried, nuts and seeds as snacks instead of packaged chips, and checking ingredient labels for the words partially hydrogenated oil, which is how trans fats are listed on packaging. If you see those words, put it back. So to recap, the 5 foods that research links to worse knee pain after 65. Number 1, refined sugar. Number 2, processed and red meat. Number 3, white bread and refined carbs. Number 4, alcohol. Number 5, fried foods and trans fats. And the foods that actively help reduce joint inflammation. Fatty fish, like salmon and tuna. Omega-3s reduce joint inflammation directly. Berries. Anthocyanins protect cartilage from breakdown. Extra virgin olive oil. Polyphenols reduce inflammatory markers throughout the body. Leafy greens. Vitamin C supports collagen production in joint tissue. And green tea. Polyphenols slow cartilage degradation and reduce swelling. You do not have to change everything overnight. That is not how sustainable change works. Research shows that even making 2 or 3 of these swaps consistently over 6 to 8 weeks produces measurable reduction in joint inflammation markers. Pick the one swap that feels most achievable for your current routine. Maybe it is switching from white bread to whole grain. Maybe it is adding salmon to your meals twice a week. Maybe it is replacing your evening drink with tart cherry juice. Start there. Build from there. That is how lasting change actually happens. If this video was useful, consider subscribing to Vital After 60. Every week we cover evidence-based health tips, specifically for seniors over 60. Next week we are covering the specific exercises that Johns Hopkins researchers say can reduce knee pain by up to 40% without any gym equipment. That one is worth watching. The information in this video is for educational purposes only and is not intended as medical advice. Always consult your healthcare provider before making changes to your diet, especially if you are managing a chronic health condition.